Hi, welcome. Thanks for joining everybody. For the last several weeks, we've been talking about menstrual cycle health specific to the period or menstruation. And I'm going to have one more talk today about what is an ideal period. So fertility health, what is an ideal period? Having a healthy menstrual cycle in total, which is from the start of your period and one period to the start of the next, is really instrumental in female fertility health. It tells us the specifics about each part of your menstrual cycle tell us a lot about your fertility health. And menstruation itself is the period or the shedding of the endometrial lining. So while we often talk in terms of menstrual cycle in relation to periods, the menstrual cycle is really the whole thing. Your period, your follicular phase, ovulation, and luteal phase. And menstruation is the time of bleeding or your period. And this particular talk is going to be about menstruation, that time of bleeding or a period. We understand a healthy period to be roughly 3 to 5 days in length and bright red, virtually free of pain, little to no pain at all, and moderate in flow, sort of moderate in flow throughout the whole thing. Now, I completely understand that each of us experiences a period very differently, and that many don't experience what would be considered ideal at all. So I wanted to talk a little bit about that. We have women who come to us asking us about a variety of things, but a lot of the times they're concerned about flow, the lightness or heaviness of flow, and particularly about the blood itself. It's not bright red, and it could be any variety of other darker colors or thin, watery, and things like that. So I wanted to talk a little bit about each of those specific concerns. Again, bright red blood is ideal and perfect. There is no cause for concern if that's the case. And flow itself can start lighter to moderate, get heavy for a day, maybe a couple of days, and then begin to taper off back to light. That's completely fine. The concerns come in when it's super light the whole time, your period is short, less than 3 days, 2 days, 1 day, or if it's very heavy the whole time. Those are when there perhaps is some sort of imbalance or something's going on that's causing those irregularities. So again, bright red blood is great, don't worry about it. But if you've got dark blood, any sort of brown or thick period, this isn't a sign of old blood, a blood that wasn't able to come out of the uterus for some strange reason. Not strange necessarily, but for some reason. And this could be that flow is just sluggish. It could be that there's lack of uterine tone or perhaps lack of circulation to the uterus. For a variety of reasons. You could maybe not be a very frequent exerciser, or you've had some sort of change in your exercise routine. You could have a sedentary job, perhaps be slightly overweight, have a variety of fertility health issues that could contribute to that. Heavy menstrual flow, and it's just not coming out because of lack of uterine tone or for some reason. Even simple things like being dehydrated can slow flow even from the uterus. So herbs and therapies that are traditionally used for this sort of issue, that darker, thicker blood that's brown or purple, or even some women have even darker than that, to learn about are fertility massage or self-fertility massage, cleansing for fertility. Fertility cleansing is what we refer to it mostly. Systemic enzyme therapy, maybe using systemic enzymes to help increase circulation, perhaps battle any inflammation, things like that. And certainly staying hydrated. Drinking lots of tea, herbal tea, uncaffeinated or non-caffeinated herbal tea, and water. Those are really great. Now, the opposite of that is pale blood, pale pink blood that's thin or watery. Usually signifies poor blood quality, which is easily enriched through diet. Iron is like the number one thing that comes to mind. Blood building herbs, but also could benefit from, or you could benefit from, hormone balancing, increasing circulation to the uterus. To healthy diet is key. when period blood is pale, thin, or watery. So you could also learn more about ways to build the blood, including more iron into your diet, whole food supplements that contain iron or iron supplements like Blood Builder or a multivitamin, perhaps the herb dong quai, nettles, red raspberry leaf, maybe red clover. It's very nutritious. Just all things to learn about. And again, back to fertility massage or self-fertility massage. Those are things to learn about if that's the issue with period consistency. Something else I want to talk about, which some of you may be familiar with, is our formula Fertilicare Phase 1 and 2. It's a monthly herbal program designed to be used, or designed with herbs to support each phase of the menstrual cycle. So follicular phase herbs and luteal phase herbs. Variety of different benefits, of course, but really for reproductive health and to help orchestrate the balance of the cycles of the phases of the menstrual cycle. These formulas are known to support ovulation, healthy hormone production and balance, support uterine lining health, obviously are in part calming to the uterus, but also help support healthy circulation. And even more specific as to helping the body produce the progesterone it needs to have a healthy luteal phase. Obviously that would be phase 2 of this program. But you could consider learning about Fertilicare Phase 1 and 2 if you're concerned about your periods. Now, neither are used during your period, but they're used to help balance each phase of the cycle so that your subsequent period will hopefully be impacted and better. That would be ultimately the goal if you're having a period problem. Period pain, very common, sadly. Most commonly caused by overproduction of prostaglandins, but the reason, some other reasons could be that there was a little bit of slip in diet. You were eating a lot of processed food, saturated fats, sugar, alcohol, caffeine before your period started. There could also be infections. STDs, pelvic inflammatory disease, and some things that are a little bit more serious like endometriosis or fibroids or scar tissue in the uterus that can cause pain and unnecessary contractions by the uterine muscle. So if you have period pain and it's not easily remedied by cold or heat packs or baths or essential oils or some of these supportive herbs, and you're not sure what the cause might be, it requires that you take an NSAID over the counter to deal with. It might be worth talking to your doctor about trying to find out if there's something more contributing to that pain if you don't know already. So I hope that was helpful. I know it's really quick. There are certainly a lot more causes and contributors to period pain, but those are the things that were all kind of off the top of my head and in my notes. And hopefully some of the changes and things that are available to you, changes you can make and things that are available to you will help you have a more regular period so that your menstrual cycle can be something that isn't dreaded. All of your questions that you have, if you would contact us, our team would be more than happy to help you. We have herbalists on staff if our customer care team can't get you information, so please reach out to us. You all have great I see that comments are still coming and I want to help, but I do need to go. So reach out to us. That's what we're here for. naturalfertilityinfo.com and naturalfertilityshop.com. There are contact us buttons in the top right corners of the pages and little circles on the bottoms with question marks that you can click on now for our frequently asked questions in a contact form as well. We're here to help, so don't be afraid to ask your questions. Or go to Natural Fertility Info and do some searching around to start and see what you can find. Thank you for joining me. This was really fun today. I hope it was helpful, and we'll see you next week. All right, bye. Thank you.